My elbow sports surgical practice really consists of a few injuries that we see commonly in active individuals and athletes. For example, ulnar collateral ligament reconstruction in the elbow, which is something we typically see in baseball pitchers, although can be seen in other overhead athletes, for example, javelin throwers. In addition, in post-traumatic cases, sometimes we'll see injuries to the other elbow ligaments, and notably the lateral collateral ligament. And so in less common cases where we see that, I perform that surgery as well. The other sort of common injuries that we see are ruptures of the biceps and triceps tendons around the elbow. And so I'm very well versed in biceps and triceps repairs, and even in some cases have seen chronic injuries where we've had to do reconstructions along those lines, kind of between the shoulder and elbow. In bodybuilders and weightlifters and strength athletes, we'll see from time to time pectoralis major ruptures, and have in some cases done some chronic injuries with kind of more complicated reconstructions to help put those back together when they haven't been treated immediately. Finally, with regard to the elbow, tennis elbow and elbow arthroscopy are other common elbow sports procedures that I perform.